When I first learned about this, I did it to lose weight. I was experiencing like suicidal depressions, and I really was aware at a certain point that I wasn't going to survive this condition much longer. So I just told myself, at least I'm going to try and be as physically healthy as possible. This is my last sort of go at this. And so what I'd love in the future is for people to get this feedback and as early as possible. When someone's having their first episode, maybe we can prevent a large course of the illness by introducing this early on, just like with some people with epilepsy, including as someone who has kids that are susceptible to bipolar, is that we can put people on this as early as possible and potentially avoid the whole course of the illness. I think that would be the best possible outcome.
I'm honored to be among Dr. Bret Scher and Dr. Iain Campbell. And I thought before we begin, maybe both of you guys could just discuss a little bit briefly your background and kind of what you do and how both of you are really spearheading this whole movement, advancing the science, application, advocacy of metabolic psychiatry.
Yeah, I'll jump in. And because I'd love to transition and introduce Ian a little bit too. So I'm Bret Scher. I'm actually a cardiologist by training, but in my cardiology practice, I really focused on metabolic, cardiometabolic health and how metabolic health related to so many other disease issues. So really kind of did deep dives on metabolic health and about nutritional therapy, lifestyle interventions to improve metabolic health, with ketogenic therapies being a big part of that. But from then, with my focus on metabolic health, then started to transition to this connection between metabolic health and mental health. And that's when I met the Bazookies and was fortunate enough to meet Iain Campbell and hear his story as well. And just really became enthralled with this opportunity within mental health, within psychiatry, to focus on metabolic health and metabolic therapies as potential treatments for psychiatric illnesses. And I really have to give a lot of credit to someone like Iain, or Iain himself, and Matt Bazooki and others who've shared their stories and are, like Ian's doing, helping further the science. And that's what got me connected with Metabolic Mind, where I'm now the director, where we're really focusing on putting forth this education about this connection between metabolic and mental health and metabolic therapies as treatment for mental illness. So I'm real happy to be here today to share this with your listeners. And like I said, Dr. Iain Campbell has been a shining light for me as an example of someone who's lived with mental illness, who's treated it with nutritional therapies, and who is sharing his story with the world to help educate and inspire others while also doing the research. Just such a great combination. So I'll turn it over to you, Iain, to give a little bit of your own intro there.
Thank you. Yes, I'm the Bazooki Brain Research Fellow in Metabolic Psychiatry at Edinburgh University. I have a PhD in Global Health from the University of Edinburgh. And I also am diagnosed with bipolar type 2, and I've been using ketogenic metabolic therapy for 7 years now. And this was something that it's a real pleasure to be on this podcast, because I originally found out about ketogenic metabolic therapy through listening to podcasts like you were doing, Dom, and promoting this as a therapy for cancer and for neurological disorders like epilepsy and other conditions. And I had no idea at the time it would have an effect on my mental health, but it was more effective than any treatment I'd ever tried in my life in ameliorating the symptoms of bipolar. And it was such a dramatic turnaround for me after having tried many things that haven't worked. I felt I need to spend as much time as I can the rest of my life trying to tell other people about this and try to explore it and understand how many people this could help.
So yeah, I mean, Iain, you're really like the poster child for this, because you live with the disorder, you've more or less managed it, or maybe even, described as putting it into remission to some extent with ketone metabolic therapies. And we'll get into that a little bit about how you do that, your personal story, but also the research that you're doing through the fellowship, and also the advocacy and the education outreach that you're doing. And also this, I mean, really, we're here to discuss the link between metabolic health and mental health. And Levels has an immense appreciation for that. They've even funded a collaborative study at University of South Florida with Dr. Allison Hull. We're looking at CGM and low carb diets, in the context of looking at normal healthy people. But even a low carb diet or ketogenic diet implemented in normal healthy people without bipolar depression improves scores on things like PHQ-9 and GAD-7. So what we're talking about here today for our listeners is not, strictly about, bipolar depression. I mean, a heavy emphasis towards that, but just towards the link really in the general population of metabolic health and mental health. And I think we have the two leading experts here that could talk through personal experience and through research and advocacy. My intro into levels was actually through the Bazookies, through Jen Bazuki. I think she's a CGM user, a levels user. And I think it was Casey or Josh connected me. So things like devices, emerging technologies like continual glucose monitoring is a very valuable tool. And Iain, I think maybe you could talk a little bit about the research that you're doing through your fellowship and kind of how you were designing that protocol, specifically ketone metabolic therapies or dietary therapies, and the different things that you're looking at.
So we just conducted a pilot trial with 27 participants with bipolar disorder going on a ketogenic diet for 8 to 10 weeks with a 2-week washout period. And we were assessing feasibility and acceptability of the diet for preparation for a future randomized controlled trial. But we were also looking at outcome measures, psychiatric outcome measures, metabolic outcome measures. And what we saw was it was very interesting because there's a significantly increased cardiovascular risk with bipolar disorder. In fact, in the UK, over 70% of people die of physical preventable illness with serious mental illness. And there's 2 to 3 times the risk of type 2 diabetes. And there's a very strong energy component to bipolar disorder that's kind of under-recognized in the research. And ketosis speaks to all of these mechanisms, but it's also a therapy used for epilepsy, and anticonvulsants are used to treat bipolar disorder. So we share medications with epilepsy. And now this other effective therapy for epilepsy is coming to focus for bipolar. So there's a lot of scientific background to why we'd want to conduct this study. And also many patients, many like myself, like Matt Bizuki, are coming forward with the help of Bret sharing these through Metabolic Mind. And these channels it's a real patient movement to raise awareness about this, because the people are reporting remission of symptoms, substantial benefits. So we want to try and understand under a bit more of a microscope of what's really happening. And we'll be publishing a paper in the next couple of months. But we found substantial changes in their metabolic profile alongside their psychiatric symptoms, alongside their brain imaging, and other parameters that we looked at that would be considered very beneficial for bipolar disorder. And it speaks to many of the aspects of bipolar pathophysiology that are important, like glutamate in the brain, serum lactate levels, the psychiatric symptoms associated with bipolar. So we're very excited to share these results, and we presented this at ISBD conference. I was there with Bret a couple of weeks ago in Chicago, and we presented alongside Shibani Sethi's work at Stanford and Georgia Ead's study with Dr. Danan. And I think it was the first time people really saw this as a serious scientific area for bipolar disorder, that we would want to study this and look at the mechanisms shared with anticonvulsants. So
I wanted to add, being in the crowd for that presentation at this international bipolar meeting, and to see people's attention and to hear them talking after the fact, because for a lot of people it was sort of a new introduction to ketogenic therapies. And it was pretty remarkable, because the data presented was impressive, and it really got people's attention. And it's such an important step, because we can talk about it all we want. We can share stories all we want. But for the treating physician who's maybe a little skeptical, they need data, they need studies. And that's what they now have. And the reaction in the room was really dramatic. And so I think we're going to see this take off in large work because of what Iain and Dr. Shivani Sethi and Albert Danan and Georgia Ead, because of what they're doing, not just clinically, not just from an education standpoint, but from a research standpoint. So impressive to see.
Bret and Iain, have there ever been any kind of dietary therapy clinical trials presented at ISBD? I mean, that's a massive step in the direction of hitting mainstream kind of for this disorder. And I think, was everybody kind of in shock that something like a nutritional intervention can have an effect? And Iain, yeah, I wasn't at ISBD, but I saw probably a similar presentation at Keto Live in Switzerland. So
yeah, it was really remarkable, because we were showing, and keeping in mind we're in a small sample size, so we were trying to present this as a feasibility and acceptability study, but we were also sharing the outcomes that we're measuring in psychiatric symptoms, metabolic symptoms. And alongside Shibani and George's data, we were showing very substantial changes in psychiatric symptoms, beneficial changes in brain imaging and metabolomics. And the kind of profile of benefit speaks to the whole gamut of what goes wrong in bipolar disorder. So I think for people watching this, they were a lot of people were very surprised and very excited, and lots of psychiatrists who were previously, I know, to be skeptical came up afterwards and were really saying we want to launch research in this area because, and I think actually the main thing I wanted to point out was that this makes complete scientific sense. We're using these anticonvulsants to treat bipolar, and here's another anticonvulsant therapy that's showing effectiveness. So let's try to explore the mechanisms of this and understand more about it. But it was really, we received a very warm response and a very open response, and people were wanting to jump in and get involved in this, which is all you can ask for with these conferences. It's fantastic.
Yeah, and Dom, you asked if there have been presentations about dietary intervention. Well, there was a big focus on this increased cardiometabolic risk for patients with bipolar disorder, and whether it's from the underlying cause itself or from the medications or a combination of both, it's clear they are at higher risk. So there was some discussion about nutrition in general and lifestyle in general to counteract or to address that increased cardiometabolic risk. But here is an intervention, nutritional ketosis, ketogenic therapy, that can not only address that increased cardiometabolic risk, but could also, looks like it also addresses the psychiatric symptomatology. So you get a dual effect rather than just trying to say, okay, we'll use drugs for the bipolar and then try and counteract the increased cardiometabolic risk with lifestyle. But here's a lifestyle intervention that can do both. And that's something that really got a lot of people's attention, and rightly so.
If you've heard me talk on other podcasts before, you know that I believe that tracking your glucose and optimizing your metabolic health is really the ultimate life hack. We know that cravings and mood instability and energy levels and weight are all tied to our blood sugar levels. And of course, all the downstream chronic diseases that are related to blood sugar are things that we can really greatly improve our chances of avoiding if we keep our blood sugar in a healthy and stable level throughout our lifetime. So I've been using CGM now on and off for the past 4 years since we started Levels, and I have learned so much about my diet and my health. I've learned the simple swaps that keep my blood sugar stable, like flax crackers instead of wheat-based crackers. I've learned which fruits work best for my blood sugar. Like I do really well with pears and apples and oranges and berries, but grapes seem to spike my blood sugar off the chart. I'm also a notorious night owl, and I've really learned with using Levels how if I get to bed at a reasonable hour and get good quality sleep, my blood sugar levels are so much better. And that has been so motivating for me on my health journey. It's also been helpful for me in terms of keeping my weight at a stable level much more effortlessly than it has been in the past. So you can sign up for Levels at levels.link/health, get access to a continuous glucose monitor and the Levels software that helps you really dial into a lot of these strategies for your life and your body.
So there is an appreciation then and a discussion about things like insulin resistance and the development of metabolic, health problems. Is that, we are privy to that in our little niche of a community of metabolic psychiatry, but within the scope and the breadth of the individuals at this conference, was this completely all new to them? And did they actually, high fat diets have been associated with cardiovascular risk. Was there a little bit of pushback, or I was wondering if there was a question and answer session sort of after the presentation of the data, when people maybe look up what a ketogenic diet is and the macronutrient ratios, as you know, Bret, as a cardiologist, lipidologist, that is what you have, been kind of a voice of reason when it comes to kind of discussing the cardiometabolic implications of these dietary therapies.
And you're spot on. There definitely was some concern, well, we see that, low carb diets increase your risk of death and high fat diets increase your risk of heart disease, and LDL is going to go through the roof. There definitely were those concerns. So there's probably like the most discussion of LDL ever at a psychiatry conference is my guess. So that's why, I'm glad I was there and I was able to speak up and kind of point out that, we have to realize that the quote unquote studies that show low carb being harmful or increased risk of heart disease, have 40% of their calories from carbs. And that's their definition of low carb, which is completely different from a ketogenic intervention. So we really are talking about two completely separate things. And, the physiologic changes that occur with a ketogenic intervention are dramatically different from just the 40% carbs, or even one study that showed 20% carbs, still not ketogenic. So I think people need to realize that we're talking about ketogenic therapies, and we can't extrapolate generic low carb, so-called low carb data to that. So that's the first point. And then the second point is just educating people that for the majority of the people, LDL doesn't go up. So in both, I think Iain, you presented data, and Shivani and Georgia all presented data about LDL and cardiac risk. And in general, LDL doesn't go up. And Shivani even presented, her evidence that cardiac risk was the same or went down. So those are the other sort of, we have to get over the preconceived notions that this is by definition a harmful diet for your heart where LDL is going to go up, because that's not the case for the vast majority of the people. And even if LDL goes up a little bit, overall calculated cardiac risk goes down because of all the metabolic improvements. So there's definitely a lot of education that needs to go on, especially in groups that maybe aren't as familiar with ketogenic therapies.
Yeah, it's an aggregate of cardiometabolic biomarkers like blood pressure medication, hemoglobin A1C, and other things like, continuous glucose monitoring, which is looking at things like glycemic variability. And then, of course, ketone levels, if you're using a ketogenic intervention. So Iain and Bret, was there any discussion or general consensus with everyone presenting on the biomarkers that we should be paying attention to in regards to mental health, bipolar specifically?
If there's anyone I could speed dial at that moment when they asked about cardiometabolic risk, it would be Bret. And so the fact that we are able to actually give quite robust feedback on that was fantastic, because it's a major topic of any bipolar conference, is the physical and cardiometabolic aspect of bipolar. So the kind of the biomarker, it's very difficult to isolate biomarkers in bipolar disorder, because you're trying to measure the activity in the brain, and of course you're getting a signal from the serum, but we're never sure how reliable it is. But the systematic reviews have consistently, for around 70 years now, highlighted elevated lactate as being a significant biomarker, is the kind of most significantly altered biomarker in bipolar disorder in the serum. And this is also reflected in brain magnetic resonance spectroscopy. And so lactate is considered a biomarker in bipolar disorder. You can't use it to diagnose anything, but there's definitely elevated lactate. And this has been related to the literature on mitochondrial dysfunction, and the kind of hypothesis being that this is glycolysis running on overdrive. And I think this fits with metabolic dysfunction in general, that there's a mitochondrial dysfunction, increased glycolysis. And I think it also ties in with what you're saying about insulin resistance in the brain. And we've always known that insulin resistance causes havoc with the whole rest of the body. And for some reason, we've kind of assumed that the brain wasn't affected in some way. And I think the scientific understanding has evolved to the point where we now understand that insulin is extremely important in the brain. And if you look at the mechanisms of action of some of the bipolar medications, they act on insulin signaling mechanisms. The primary target of lithium is the phosphatidylinositol cycle, and there's been untold amount spent on studying this mechanism for pharmaceutical intervention, but it's actually a key component of insulin signaling, as are many of the other drug targets like GSK3 studied in bipolar disorder. So I think the actual way we treat this at the moment does speak to these metabolic aspects.
Hey, Bret, do you want to comment on that? Maybe follow up on the lactate, perhaps as a mitochondrial metabolic biomarker that could be implicated here. And yeah, and that's kind of a new one for the community too, and something we're actually very interested in.
Yeah, and well, I think what I want to answer the question by focusing on the word that you said. Was there a consensus? And definitely no, there's not a consensus. Like a lot of the presentations, we're still using fasting glucose as like the measurement, which we know is just such a misleading metric. And things like CGM, looking at your average daily glucose, your glycemic variability, is so much more informative than just a fasting glucose. So there's definitely some education that needs to go on. And there was one talking about insulin and HOMA-IR, and even mentioned CGMs, which is certainly a step in the right direction, but that was one out of many. So there definitely needs to be some education from that standpoint. And I think lactate is a fascinating marker that we should be following. that's going to take some time to adopt as well as people get familiar with it and learn how to use it. But I think it's clear we're on sort of the cutting edge of learning more about how to monitor metabolic health, and that what we have been doing with fasting glucose is woefully inadequate. And so we're going to keep learning more and getting more comfortable with things like lactate and CGMs, and of course blood pressure and A1C and fasting insulin and HOMA-IRs, and using all of those together to assess metabolic health, and then using that as the broader picture of cardiometabolic health. So there also was a lot of discussion about LDL, but as we know, we have to go way past LDL to assess cardiovascular risk as well and look at the whole picture. So it's clearly emerging, and groups like Levels are certainly leading the way when it comes to getting beyond just fasting glucose and getting more intensive measurements of glycemic control.
Do you think there's an opportunity to look at stress hormones, for example, maybe catecholamines, or maybe more importantly, cortisol? Because cortisol, in myself and many others, we're looking at a big data set now. That dawn response is kind of ubiquitous among healthy individuals and across the board. So, and people who have dysregulated cortisol or hypercortisolemia, maybe at higher risk. And is that something we should be looking at in this population?
Yeah, it certainly makes sense. As you know, I'm sure with cortisol, the timing of measurement makes a difference, and how you measure it makes a difference. So, a lot of those things need to be worked out and consistent, but certainly makes sense. I mean, as a society, I think we can say we're not very good at managing our stress, and it's clear that impacts our health, our metabolic health, and our mental health. So yeah, I think that does make a lot of sense to focus on.
Especially in the context of this population. And I think maybe anxiety disorders are on the rise, and maybe that's a contributing factor for triggering, an event. And, bipolar disorder, maybe Iain can talk about this, is very cyclic, and maybe, it's from seasonal, circadian, and, there's different things that can trigger the disorder, including anxiety. And maybe it could follow some kind of stress biomarker. So I think that's a fruitful area for research that kind of remains untapped. And I've been personally interested in, because we've done some research, in the military and with NASA, and looking at, operationally how these stress biomarkers can be elevated. And then when we go back and look at the cardiometabolic biomarkers, we see that they're dysregulated too. So it's like, is the cortisol impacting that, or, are there other factors? Is just the nature of the operational activity impacting cardiometabolic biomarker, or is it being driven by the stress hormones? So something to look at.
Yeah, absolutely. There's two major things I think CGM could be really useful for in bipolar disorder and schizophrenia and major depression. There's definitely this circadian aspect to bipolar disorder is one of the most well-known features, going back to like the 1960s when Jean Fowry was talking about folie circular madness, they called it. And it was very much pointing out this circadian aspect, where if you disrupt someone's circadian rhythm, they'll have episodes. And if you improve someone's circadian rhythm, they'll have less episodes. And it's almost like the body's energy regulation is being dysregulated. And even the earliest descriptions of bipolar by Emil Kraepelin, who was sitting with patients in hospital observing them, he was saying that his exact words were the lack of energy during depression is very especially conspicuous. And during mania, they have unlimited energy and they work all day and night. And you can actually take someone who's depressed, and you can even do things like keep them up till 2 or 3 in the morning, and this will help them to feel better. And then if you take someone and do the opposite, and you have someone who's manic and disrupt their sleep, they can become worse. So there's a really strong circadian aspect. And obviously when you wear a CGM, this becomes really apparent to you with the dawn effect. And I did this for a year myself, wearing a CGM, and this cortisol rise that you described in the morning is significant. And I think it also reflects, I think it's also correlated. We were seeing in the blood levels of people in our study that glucose and ketones correlate to their psychiatric symptoms. So it's something that's happening in real time. It's not just like the extended effects of cortisol over time, but also the daily effects of cortisol surges and glucose surges, I think could be really interesting to study.
I think the question of stress is really fascinating. And one of the amazing parts of Iain's data that he presented was this correlation between ketone levels and symptoms, psychiatric symptoms. And as we know, ketone levels can change throughout the day, and there are a number of different things that could impact that. And stress hormones certainly could be one of them. So I'd be fascinated to learn more about the role of changing stress hormones and altering ketone levels, and then how that impacts symptoms of mental illness, or even symptoms of, or even like mental clarity, and executive function and thought process and energy levels, and how all that is intertwined. And you can think of different interventions. Like if your ketones drop at a certain point, well, then you do certain interventions to try and raise them. So whether that's managing stress hormones, or whether that's taking an exogenous ketone, or taking an MCT oil, or doing some other type of intervention to raise those ketones back up in a circular pattern, how does that impact your cognitive function, your mental health? I think that's a really fascinating area of discovery. And Iain was sort of, I think, the first to really show this data that there is this direct correlation between ketone level and symptoms of mental health.
Yeah, that's so maybe looking at stress too. So maybe, normal stress response, which we want, is an elevation of cortisol in the morning, but not so much in the evening. So maybe that could be like indicative. But another thing that you brought up, Bret, is just, other things that could be used to modulate or augment metabolic physiology to improve these things, including an elevation of ketones. And I know exercise is a big lever that we can pull. Not everybody's going to do it, but I know, Iain, that you're a huge advocate of exercise, strength training, exercise in general. So in addition to sleep and diet, I think of exercise as a metabolic therapy. So in regards to your participants in the study and the feasibility of looking at exercise, and perhaps there's a synergy, a diet, lifestyle, exercise synergy going on there, where 1 and 1 equals 3 when you combine the two together. So your thoughts maybe personally, and how perhaps we could research that or get some insights into that.
I would equally like to ask you that question. I think that the metabolic therapies are ketogenic diet is one metabolic therapy, and there's so many things that affect metabolism, like you're saying, circadian rhythm, exercise, sleep. They're all interrelated, and they're all acting on similar underlying pathways, which are also some of the pathways that we manage through medication in bipolar disorder. So I think that combining exercise and diet is an absolute no-brainer for mental health. And I think, just anecdotally, I am a different person if I exercise, if I do a run in the morning and bring down my glucose levels. And one of the most important things that helped me realize that was looking at a CGM and seeing this surge in the morning, and seeing something is happening with my metabolism in the morning that makes the symptoms much worse in the morning if you don't manage it. So going for a run, I can kind of flatten a lot of that glucose curve and feel much, much better throughout the whole rest of the day. And I think that this is something that could be revealed by more people wearing CGMs and examining this.
Mm-hmm. Yeah, potential synergy there. I remember years ago, and Jung Ro was there, Cure for Epilepsy was there. So UCB Pharmaceuticals, they make Keppra, and they held a meeting in Belgium, I believe, looking at, they're very interested in the ketogenic diet and perhaps synergy with this anti-epileptic drug. And I think maybe there's, we're discussing here a metabolic therapy that in the context of an adjuvant, at least, but also perhaps a replacement, for drug therapy along the line. But so people who are already on pharmacotherapy, maybe these metabolic interventions, there could be some synergy there. But also diet, exercise is a huge lever that is altering our metabolism. And I think you bring up some good points. And I know, I'm not suffering, at least that I know of, any, mental disorder, but I know exercise has always kept me sane, so to speak, in grad school. And I kind of, self-medicate with exercise and just defaulted to that. But I established those early patterns early in life. And I think without that, I don't know where I would be. And I see that in other graduate students and people in academia too, that it's such a powerful therapy in and of itself.
Yeah, I think exercise has like sort of a dual therapy effect. And one is the endorphins that come from exercise. And I don't know studies on this, but I think it's clear. Some people get them and some people don't, right? Some people just feel great with exercise and some people maybe don't, and from the endorphin side. But the other part is the metabolic health side. And like you said, exercise is a metabolic therapy, and practically everybody is going to get that benefit by maintaining or building lean muscle mass, by by doing cardio and improving your blood sugar and your insulin and your glucose sensitivity, that those things are going to improve your metabolic health, which then will translate to some degree to mental health as well. So I think there is sort of that dual-pronged approach for exercise for improving people's overall mental well-being.
And brain energy, not just like BDNF, but I think Rhonda Patrick had sent me some papers, and there was a research scientist, and there was a couple papers sent to me on how we exercise that elevates circulating levels of lactate in the millimolar concentration, and that freely crosses the blood-brain barrier via the monocarboxylic acid transporter to restore brain energy. So our brain would have free access to this alternative fuel. And I do think lactate is underrated. Actually, before I even started in ketones, I was interested in alpha-L polylactate, which as a source of an alternative fuel, I'm still very interested in that. But I think, exercise, does so many different things, and muscle is an endocrine organ, and it's releasing myokines and other factors that are altering brain health and maybe stabilizing, our mood. But the lactate question is something that's kind of interesting too. But at rest, if lactate is elevated, that's a telltale sign of metabolic mitochondrial dysfunction. So it feeds into that mitochondrial etiology of mental health.
It's so interesting, the lactate question as well, is because exercise is also a trigger. So it generally improves people in depression states. But there's a kind of, and I've definitely experienced this, is that intense exercise can be a trigger for mania in people with bipolar disorder. So if you do the kind of moderate intensity, like below lactate threshold exercise, it appears to be beneficial. And then the kind of higher intensity exercise, people can get manic. But I find that really fascinating in the context of what you were saying about lactate, because you're importing this additional fuel source into the brain, and you're having sort of heightened power and activity of the brain in the EEG studies I've seen on that. And it's also importing glutamate alongside the lactate. So this glutamate and lactate flooding the brain after exercise, I wonder whether that is a risk factor for manic episodes, but also what does that say about what a manic episode is? I have a paper about this I just published called Metabolic Overdrive, Glutaminolysis and Hyperglycolysis in Mania and Bipolar Disorder. And I think this post-exercise state is a significant risk for mania, but it also reveals an interesting aspect of mania that we were showing a ketogenic diet was improved, which is increased glutamate metabolism in the brain. We're showing between 11 and 13% reduction in glutamate in the brain of people on our pilot study. And so this is what a marker of response to anticonvulsants as well. So I think these unique metabolic states could reveal aspects of the condition that we could use to optimize ketogenic diet intervention.
And with the glutamate, Iain, did you also look at GABA? Because work in our animal models show that glutamate can stay the same or go down, but we have correspondingly higher levels of GABA. And we do immunocytochemistry or Western blots for glutamic acid decarboxylase 65 and 67, and these are always elevated with diet therapy, but also with a ketone ester therapy, which makes me think that the ketones are altering the enzymatic production of the enzyme and maybe the activity of that enzyme to make more glutamate GABA. And this is one of the underlying theories that we're working on.
Yeah, absolutely. And there's a glutamate GABA balance in the brain, and it appears that glutamate is reduced and that GABA is increased on ketogenic diet. And one of the proposals I made in this paper I just published was that glutamate is also a metabolic substrate in the brain. And this was Hans Krebs' original focus on glutamate in his early papers. And so if glutamate is used as a metabolic substrate in the brain, this is fulfilling a similar role to ketones. And if you provide ketones, it reduces the need for glutamate to be metabolized in this way. And what was kind of interesting about that is that if you have glutamate being used to this as a metabolic substrate in the brain, you get several of the markers of bipolar disorder, such as decreased N-acetyl aspartate. It's using up the aspartate pool. You get this increased level of glutamate, and ketogenic diet bringing those down in that context would make a lot of sense. So I think in the same way we're looking at the role of metabolism in psychiatric disorders, we could also look at some of these neurotransmitters that have been a focus in bipolar through a metabolic lens to understand some of these states of mania and depression.
You guys are getting deep into the science here, but I wanted to take a step back for the broader perspective, because I think it brings up such an important point that we're talking about a nutritional intervention that changes the neurotransmitters of the brain. Like that in itself is pretty remarkable, because you talk about, you can improve your metabolic health by going on a low calorie Mediterranean diet, or just reducing your calories by 500 calories. But those aren't going to change the physiology of your brain and the neurotransmitters of your brain. And that's why I think it's so important as we talk about a ketogenic diet in this setting. It's actually sort of a ketogenic medical intervention that does these amazing things of changing your neurotransmitters in the brain. So I want to make sure people understand that very important concept as we're talking about the sort of the deep science here.
And Bret, I mean, that's a super important point. Like that overarching change in our metabolic physiology impacts brain energy metabolism, brain neuropharmacology. So do you think, and this is an ongoing question even in this, niche here, that a low carb diet or maybe implementing, intermittent fasting, and I just interviewed someone yesterday about how that changes the whole microbiome, and, low carb intermittent fasting could be powerful, equally as powerful. So Bret, I'd like to get kind of your sort of thoughts on not necessarily a strict clinical ketogenic diet, but the potential, if a low carb diet defined as, under 100 grams of carbs, and sticking to fibrous carbs instead of sugars and starches, or intermittent fasting could have equal amount. And if the benefits are linked to a loss of body weight or changes in body composition, and if you could achieve that through other dietary means, and if that's one of the things, changing our mental health. So in discerning whether it's the ketogenic therapy and the elevation of ketones versus just, body composition or metabolic markers.
Yeah, I think it's a fascinating question. And I guess to start the answer is, I have to say a lot of this is taking what we have and making best guesses from it, and that we need dedicated studies looking specifically at this question, which haven't been done, but I'm sure will be done. But I think we have to look at it from two different aspects. And one is improved metabolic health, and one is changing the fuel source for the brain. And so when it comes to improving metabolic health, then yes, a low carb, 75 gram fibrous carbohydrate diet, combined with, exercise and sleep, is going to improve metabolic health for just about everybody. And it may not be, the most powerful intervention, but it's going to be a powerful intervention that's going to help people improve their metabolic health. By improving metabolic health, I think you will see benefits from mental health. But then the next question is, well, is there more? And I think the more is changing the fuel source for the brain from using glucose to using ketones, bypassing absolutely any potential insulin resistance that exists in the brain. And then you see decreased neuroinflammation. You see a balancing of the neurotransmitters with increased GABA, decreased glutamate. And I just don't think you're going to see those things with simply improving your metabolic health. That requires this metabolic shift and fuel shift from glucose to ketone. So that's not to say you're not going to get any benefit by just focusing on metabolic health with a low carb diet. I think you will. But I think if you want to optimize or intensify the treatment as the medical treatment, that's where a ketogenic therapy comes in and changing the fuel source with ketones.
Great points and very well stated. So a ketogenic diet is more or less a prescriptive diet therapy, or a prescription strength metabolic therapy, as opposed to a low carb diet. A ketogenic diet truly is, it is legitimately in action a prescription strength diet therapy, and it's prescribed in epilepsy. It has a wide track record. And it was very interesting as I got more and more into this research. People didn't know about the epilepsy research, which was kind of like my wheelhouse, and the overlap between the anti-epileptic drugs and bipolar too, and that may be some common mechanism there. So it makes sense that you may need to achieve and sustain that therapeutic ketosis to get that continuing benefit on the brain in this context.
Yeah, I think that's well said. And with that, I'll put in a selfless plug that we have a number of videos on this topic, and especially that connection between epilepsy and mental health and ketogenic therapies at our Metabolic Mind YouTube channel. And unfortunately, though, I'm going to have to jump off, but I really enjoyed this conversation. I want to thank you both and thank Levels, and I'll let you two continue the conversation, because I'm sure you're going to have a lot of more fascinating things to talk about. But thank you very much.
Thank you, Bret. It's great having you. So what are some practical steps individuals can take to improve their metabolic health and in turn, positively impact? So we've been talking largely about psychiatric disorders and bipolar but through, being a researcher and being a patient too. I mean, you have a sort of knowledge in a broader context too. And what are some like actionable things that our listeners can do in regards to, dietary approaches or metabolic based approaches?
I think you hear again and again when you speak to people with bipolar is that the early morning is the worst time. It's when you wake up and you're faced with this state of depression, and the state of depression is not really so much feeling sad as it's like a state of physiological crisis that the body plunges into, where people go into catatonic states of depression where they can't move and there's increased lactate in their blood and they feel like they've run a marathon even though they've not even moved an inch. And it really is that state of complete physical exhaustion that happens for no apparent reason, and it just comes over people during these episodes. And so it's extremely, unfortunately, this makes people very hopeless because they can't do, even if they have a family that they care about more than anything in the world, or friends or a job, they can't physically summon the energy to interact with it. And it's very discouraging for people. So if anyone is experiencing that, I would say that I've been to that for many, many years. And it took me a very, very long time to realize that metabolism was anything to do with that state. And now if I maintain ketosis, I don't have to experience that state of physical exhaustion that happens. And we're still trying to understand why that happens and what this benefit provides. But I think that for me, maintaining ketosis is something that is the only thing that's ever turned the dial on that for me, is these severe depressive episodes that I come out of them when I go into ketosis. And I'm also someone that, like with epilepsy, has to stay on the diet. If I come off of it, I experience those depressive episodes. So I need to maintain the diet over a long time. So I think that ketosis and like you're saying, exercise are the kind of 1-2 punch that can make me someone that's functional and able to do things I want to do and look after my family and do my job. And so if you can find that combination, I think it could be really helpful for people. But I don't recommend it until we have RCTs, and I would prefer people speak to their psychiatrist and a dietitian and do this very carefully, because there can be, we need to understand a lot more about this. But for me personally, that has been what's really helped, is the ketosis plus exercise with the depression, especially.
So Iain, you kind of stumbled upon this dietary therapy yourself, and then without the use of, from my understanding, a registered dietitian or clinician, you just sort of started doing this yourself, right? To more or less, I mean, did you have an open communication with your doctor? Because I get so many emails and so many people, email me and or reach out to me where they're just looking for resources. So it kind of brings up the next question. It's like, how can healthcare professionals collaborate and ensure, that this is, where can people get help essentially? And I know you're working on the metabolic mind front through education, advocacy, and research. All three of those things, in addition to, being a patient yourself, you're like at the forefront of this. But what do we tell our listeners out there who may be dealing with this? Where should they go?
Yeah, so I mean, basically, when I first learned about this, I did it to lose weight. I was experiencing like suicidal depressions, and I really was aware at a certain point that I wasn't going to survive this condition much longer. And I had a wife and a family, and I wanted to do lots of things, and I realized this just wasn't going to happen. And so I just told myself, at least I'm going to try and be as physically healthy as possible. This is my last sort of go at this. And so I actually did an Atkins diet. I got the kind of Atkins diet book, and I did a very strict version of it that I now realize put me in ketosis. And when I saw that the weight loss, I lost about 50, 60 pounds of weight. And I saw that at the same time, my psychiatric symptoms were going away, which to me was completely remarkable after trying this. And the resources I had available were it was really listening to your podcasts, and I listened to your shows on Bulletproof Radio, and like you were the person that was like telling people about this for physical health, but it was really affecting my brain as well. And so when I was reading your research, I was like, oh, this is to do with epilepsy and neurons and membrane potentials. And it really spoke to me as someone who like researched bipolar disorder scientifically. So at the time, I wish I could have done it with support from a psychiatrist who understood metabolic psychiatry and these aspects of it. But I was very much doing it just for my physical health and also experiencing these mental health benefits. So what I'd love in the future is for people to get this feedback and as early as possible. When someone's having their first episode, maybe we can prevent a large course of the illness by introducing this early on, just like with some people with epilepsy. And that's my hope, including as someone who has kids that are susceptible to bipolar, is that we can put people on this as early as possible and potentially avoid the whole course of the illness. I think that would be the best possible outcome. And I'm not sure how frequent that is in epilepsy, but I do know that it does happen. So
I know it's often overwhelming for people and families, when parents reach out to me to prepare a ketogenic diet and put their child on it. And in some conditions, they're just averse to the high fat intake. Was that difficult for you? And do you think in this particular patient population, that it would be, I mean, I think we universally agree that we need to agree on a standardized ketogenic therapy. It's like when you give a person a drug, right? You want to make sure that this drug is standardized. So if there's a clinical response and outcomes are measured, you could say that this particular therapy did this particular outcome. But if you have a wide range of studies using, modified Atkins, clinical diet, low glycemic index diet, I think it's important to sort of start with a universal ketogenic diet from there. And can people do this themselves? Or I know there's certain services that are coming online, like Cook Keto, for example. I'm an advisor for them, but they're not kicked off yet, looking for funding, that will actually make therapeutic clinical ketogenic diets where it could just go to your doorstep. It's like having a drug delivery to your doorstep. Do you think that's going to be super important? Or do you think it's just education from the nutritional front, along with monitoring, like continuous glucose monitoring, so you can course correct and adjust your diet as you go?
Yeah, I totally agree. Having some standardization of the diet, like with epilepsy, like the Charlie Foundation type recommendations. And I know that Bret's work at Metabolic Mind is working towards having this kind of outreach to patients that, like the Charlie Foundation did with epilepsy, and it's making a huge impact already. And we're seeing people experience the benefits. And I think that having meal deliveries would be fantastic. And one of the things about going into ketosis is that there is, just like we were saying about exercise, the brain is flooded with these metabolites. When you add ketones into the brain, people can become mildly hypomanic in the transition. And so Chris Palmer's talked about this for a long time, and George Eads. And so, but we found in our pilot study, we could completely manage, we could avoid this by having a 2-week or extended adaptation period where we gradually introduce the diet. So I think that it'd be really interesting to look at the delivery and, like you say, the standardization to see what's best for people with these mental health conditions and how can we do it the most safe way possible. And the expertise of dietitians, Niels Potter, Bess Zupek, and Helen Grossi, people like this are just completely invaluable for their use of it in epilepsy. A lot of the kind of barrier to ketogenic diets, obviously, people feel like it might cost more than their normal diet. We saw in our study very high levels of adherence, over 91% adherence, as measured by daily ketone levels to the diet, and that people are willing to do this. People with bipolar, when they experience the benefits it can bring, are willing to stick with this. Just like in epilepsy, if you prefer not to have, if you prefer the diet over seizures, it's a very powerful motivator. But then still, there's times that people will fall off, or they go to a family event and so forth. And having the ability to have pre-prepared meals and delivered meals and snacks and things they could take around, I think would be really powerful. And I also want to mention it could be really impactful in low and middle income countries where people can't access psychiatric care. My friend Nomley, who I spoke to recently, lives in Nigeria, and she doesn't have any mental health care access of any significant kind. And it's associated with cost and corruption in their governments. And if you could employ ketogenic diets in low and middle income countries where the vast majority of people with bipolar live and are suffering much more than people in Western countries, this could be a really impactful intervention, I think, from low incomes in these Western countries and in low and middle income countries.
Yeah, I mean, I think people in these countries really have no idea about metabolic psychiatry and the potential for dietary therapies to even impact this disorder or other psychiatric disorders, which kind of leads to a lot of the education outreach you're doing and advocacy. And maybe you could tell people about kind of your efforts too, not only for doing clinical, research, but also on the podcast front and creating an educational platform so people really have access to this. Just much like you finding, a podcast on the ketogenic diet, me talking on Tim Ferriss or something. So that's maybe the way that we need to reach people. And I know this podcast, like podcasts have been instrumental for Levels to get the this message out on metabolic control and CGMs?
Yeah, like absolutely none of this, or none of my research certainly would have happened without your outreach and letting people know about ketosis. It wasn't even something on my radar until you started doing the Tim Ferriss interviews and the Bulletproof Radio and so forth. And it really was something that I didn't know could help me. And I found about it through physical health. I thought it could help me improve my weight. And then all this came secondary to that. So I felt like I just want to do what I can in my small way with my own podcast. I do a podcast called Bipolar Cast with Matt Bizicki, to bring patients on who want to share their experience. We've both shared our own diagnosis and our experience with keto, and we've got about 22 interviews now with patients and clinicians, and we're trying to make people aware that this is a possibility because it's not on the radar for many people at all, and this is made possible by the fellowship that the Bizicki Foundation has given me. And this was through their experience with their own son having the same experience with bipolar and ketogenic diet and wanting to outreach. So it's really been a wonderful experience, and we've started to do fundraisers for people on the podcast, and we just got Mia fundraising to do Georgia Eads' ketogenic training course, and we're seeing that a lot of the people that are having this result also want to do their own bit to spread the word and are becoming training as dietitians, going back to university to get involved in research, trying to do anything they can, because we're like, oh, something is really working for us. And that's not, unfortunately, the normal experience with bipolar disorder. It's often a long journey of things not working well. So people are excited and want to talk about it.
Mm-hmm. Yeah. So in addition to the podcast front and what you're doing with Bipolar Cast, creating an education platform, for example, where clinicians could get educational credits to further and advance their education on this front, I think that's going to be instrumental. And yeah, I look forward to talking to Georgia Eid soon about her program and how she's working to advance it on it, because we're not going to make inroads until like patients can know about it, but they really need a network of people who are knowledgeable on implementing these things to have that support network.
Yeah, and if I could give a shout out to Bret's work on Metabolic Mind. Bret is directing this organization to raise awareness about this, and he's really one of the first people to really put his name behind this with all his expertise in ketogenic diet metabolism, and to say this is something that could be really helpful. And so like yourself, raising awareness about ketogenic diet, I just can't say enough how much this is appreciated by people with mental health conditions, because we haven't had new treatments in over 50 years. Really, we've had very few new treatments, and those that are given to us have substantial metabolic side effects where you put on 20 or 30 pounds, for example. And so we need adjunct treatments and therapies that we can use to manage this and prevent this cardiometabolic risk. So Metabolic Mind are reaching out to people, and through Bret's work and through Bipolar Cast, we're interviewing patients to talk about what we're seeing here.
Yeah. The track record for drug treatment is abysmal. And from what I've seen so far from your data and other data is emerging, I mean, it's super encouraging to see this. It will be ultimately available as a therapy, as a choice, and for people to have those choices. And big props to Bret for putting his name behind this movement too. I mean, and being at the level that he was, I think we need more advocates like him, like you, and published research scientists, and also the rare person that has that interplay between academia and influence with the media and stuff too. I think you need kind of that dual things to really move this to advance the science to application. Is going to be super important. Well, thank you for everything that you're doing, Iain, on the research front, on the advocacy front. And maybe you could tell people, again, you've already mentioned it, but maybe you could tell people where they could find you, how they can contribute, and how they can learn more about this.
Yes, I have a Twitter account, Iain Campbell, PhD. You can find Bipolar Cast on YouTube if you search Bipolar Cast or Keto Bipolar. Lots of interviews with patients, and metabolicmind.org has lots of informational videos by Bret about ketogenic diets for mental health. They're fantastic and a really great resource if you're looking to look into this for the first time.